Hello, my name is Dr. Anna Mihalcha. I am the president of AM Medical LLC, and today I want to talk to you about our innovative peptide program. So, what are peptides? Peptides are short-chain amino acids, and they are very much functioning in the body like a key to a lock, and they unlock that specific area, for example, of a gene or of protein expression or hormonal expression very specifically. So these peptides are considered biologicals. These are fragments of amino acid chains that actually have been produced in the body and are in the body, so the body recognizes them and doesn't have any reaction to them, and because they're so specific, they don't really have any side effects. So this is a very innovative and new healthcare field that is emerging. So I'm a member of the American Academy of Anti-Aging Medicine, as well as the International Peptide Society, and through those two academies, I've been researching and learning a lot about these peptides and implementing them into clinical practice. So we are also working with compounding pharmacies, one of which is actually the world's leader in peptide research and compounding of pharmacies of these peptides. And so we are getting these compounded peptides whenever they are newly coming to the market. And so there are new peptides coming out every month. Right now there's 60 peptides FDA approved for clinical use, and there's about 7,000 peptides known. So I want to tell you a little bit about the areas that we can affect with peptides. So the first area is anti-aging medicine. One of the first peptides that was ever found in Russia was epithalon, and it was studied in humans as well as animals and found to have significant properties in terms of reversing aging. Epithalon lengthens telomeres, it works on the pineal gland and increases secretion of melatonin, as well as it's been very promising to restore the function of the pancreas, to help with diabetes, reverse Alzheimer's, dementia, and have many other very beneficial properties for the body. So the epithalon has been previously combined in studies in very old people, in 90-year-olds, with thymidine. Thymidine is a peptide for the thymus gland, and it can reawaken the immune system. And so these two in combination in the very old population have had extraordinary improvement in what's called cardiovascular mortality, meaning that people had 50% less deaths from heart disease and strokes, and they had significantly improved functional ability in their life. So what does that mean? It means that within 3 weeks of taking epithalon, their ability to exercise and to move was reversed by 4 years in age. So these are very important in the anti-aging realm. We also have GH copper. That is more of a peptide that's really used for collagen synthesis improvement, for skin disorders. It helps with wrinkles, it helps restore the skin. But it also has been shown to have significant beneficial effects to restore about 4,000 genes, that's 30% of the human genome, back to health. So GH copper is often used. It also has properties for people with severe lung injuries or COPD. It appears to really help with the lungs. GH copper is available as a subcutaneous injection, so that has more systemic effects, meaning for the whole body. But it's also used as a peptide for cosmetic products, and you can even use a foam to regrow hair. So the other absolutely novel peptide that recently came out. It's been investigated for some time now, is called MOTS-C. And MOTS-C is one of the first peptides that are accessing mitochondrial DNA. Mitochondria are the powerhouse of the cells. And what this peptide does, it actually can transpose the nucleus and make the cells resistant to metabolic stress. So metabolic stress, that's like oxidative stress, inflammation, is what makes us age. So this peptide makes us resistant to aging. It has significant effects in decreasing insulin resistance, which is a way that we age by increasing the blood sugar. It allows the muscle cells to utilize blood sugar much better, and it also has weight loss properties. This particular MOTS-C peptide has been associated with the gene in a Japanese population that has extreme longevity of 125 years with extremely good health. So MOTS-C is a phenomenal addition to our longevity and anti-aging program. The next area of peptides is really the cognitive peptides as well as cognitive performance enhancement. So we have one area that is affecting the brain, and that is very specific for people like dementia patients, Alzheimer's patients, Parkinson's patients, people with brain trauma, strokes, who really need to have peptides that are regrowing healthy brain tissue. So we have those, one of which is called cerebrolysin. Cerebrolysin has had extraordinary success in Alzheimer's dementia in the reversal of it. It's been investigated for a long time. It's very, very successful and in clinical outcomes. We do have other peptides, one of which is very recent. It's called dihexa. Dihexa has been found by the University of Washington, and it is in its effect 10 million times more powerful than brain-derived nerve growth factor, and about 7 times more powerful than brain-derived neurotropic factor. It makes the brain grow new dendrites and synapses. It is called the wonder drug of neurology. And really for, again, people who've had traumatic brain injuries, for dementia, this is an extraordinary peptide that is able to recover brain function. In the area of cognitive performance enhancement, if we really look at that, it is not just about making new synapses and having faster firing power as well as improved learning ability, but there's also the aspect of controlling anxiety and depression. So we have here innovative brain technology, the WAVI EEG, and on this brain scan, it's really visible that people can have very good physical reaction time, that it can have good density of neurons. But then if they, for example, have difficulty in the hemispheres to have coherence, and which means communication between the different hemispheres as well as front and back coherence, or if they have low voltage, their cognitive performance can be impaired. So you can have, for example, a person who's in their 20s who's used drugs and has damaged their brain, and their brain age is like in their 80s. So in order to reverse something like that, oftentimes we also have to address the component of anxiety and depression. In the brain, depression looks like dementia. So there have been a lot of studies of people who were deceased with depression, and depression really has has substantial effects on the brain. Anxiety is something that really affects brainwave function. We can see that specifically. And then the third aspect is attention deficit disorder. So when we treat somebody, when we have a younger person, or let's say, there's a CEO and they just want to cognitively have enhanced performance, they want to be able to concentrate longer, they want to be able to get their work done in a more focused manner, learn faster. So those things are all important, but then if there's an anxiety component, we don't want that interference. So we have peptides that can address all of these aspects, one of which is called C-LANC. C-LANC has profound anti-anxiety properties, so it can be used for people with anxiety, depression. It's also a nootropic, meaning it allows for new brain cells to grow and wire new connections. It enhances learning and memory. It's been used in Alzheimer's and Parkinson's disease, but it can also be used for cognitive performance enhancement. We do have CMAX. CMAX also has been used in Parkinson's, in dementia, attention deficit disorder, PTSD. CMAX also has anti-anxiety properties and anti-depression properties. The big thing about CMAX is also the ability to enhance learning, again, memory. So that is a wonderful property. So there is different peptides for different individuals who have different aspects that are affecting them. The other one that is really more targeted towards anxiety, so when we're endeavoring to get away from using pharmaceutical antidepressants because they have so many side effects, if we use targeted peptides, people are tolerating that very well and they're cognitively able to function well. So we have anatiricum, that's a capsule, that's a peptide, has really great effects in terms of anxiety. And so none of those peptides have issues with withdrawal symptoms, with habit-forming properties. So that's a wonderful thing to have in terms of the repertoire for people who've had subclinical anxiety and depression. Sometimes you have very high performers. They've functioned all their life, but there's been just this ongoing low mood and slight anxiety. They can get everything done, but they're anxious. There is another wonderful new peptide that just came out on the market, and we're very excited to be able to offer it. It's called HHNP 8. It is honokiol. That is a substance that's been extracted from magnolia bark. It has profound anti-anxiety properties without side effects. So with regular pharmaceutical drugs, if you give somebody this, like lorazepam or Ativan or Xanax, and you give that to them at a high dose, it will resolve their anxiety, but it puts them to sleep because it affects their muscles. And so with the honokiol, we have something that is extremely effective for panic attacks, anxiety, but it does not have any effect on muscle tone, and people can function but without their anxiety. So that's a really wonderful peptide as well, and I'm very excited. I'm very passionate about cognitive performance enhancement. I have a lot of compassion for people who have anxiety and depression. It's very prevalent, and I think that now there is a safe way to treat this and say, okay, I want to reverse my brain age by 30 years. And absolutely, can we do that? Yes, with these peptides. When we nutritionally optimize you, we hormonally optimize you, which also has a lot of receptors in the brain, and then we add these peptides, we can cognitively enhance a human being substantially towards the future. So that's a wonderful, wonderful repertoire of tools to have. The next area that is of interest in regards to peptides. It's really its application into weight loss, and there is tremendous amount of peptide availabilities. So we have peptides that again can be individually targeted because for different people there's different things that they need. For example, we have CJC1 1295 with ipamorelin. So that's a combination peptide. It is a growth hormone releasing hormone analog. So growth hormone is a hormone that has tremendous applications. And it's kind of like this, this peptide that has a lot of keys to unlock certain areas of functioning. So the growth hormone itself can have substantial side effects. So instead of using just the growth hormone, what's been done is that fragments would be clipped off that do these very specific things, and then we can give this to people and they don't have the side effects and it's much safer, but they still have these targeted effects. So the peptide that I was just mentioning, so we have profound weight loss effects, we have muscle enhancing effects, we have cognitive performance enhancing effects, better sleep, better energy, has profound anti-aging properties. So that's a wonderful way to enhance your weight loss and basically reform your body towards a more healthy state. We do have ATTM Lexanox. That's a wonderful combination peptide. The ATT has more anti-inflammatory property. Again, we always want to address inflammation because that's what makes us age. The amlexamox part has been shown to significantly reduce hemoglobin A1C, which is your average blood sugar. So when we get this down, that's another mechanism that we're able to address prediabetes, diabetes, and treat that. And then it has lipolytic activity, meaning weight loss ability. So in somebody who's already pre-diabetic or diabetic, the ATTM Lexamox is a wonderful possibility to help out in terms of accelerating weight loss and metabolic rate. We do have tesamorelin. Tesamorelin is also one of those fragments from the growth hormone that addresses more people who have abdominal fat issues, but it also reverses arteriosclerosis. It's been shown to reduce the thickness of arterial plaques in the carotids, and it reduces C-reactive protein, which is a marker for inflammation. And then we have tesofenadine. Tesofenadine is an appetite suppressant. It's about twice as effective than any weight loss drug out there on the market. It's very, very effective. It's very popular, so it frequently is on back order, but that's another one that is really wonderful. So there's a lot of things that we can do, not just with peptides, with other injectable forms of lipolytics, but when they're used in combination therapy, weight loss really is no longer this overwhelming hurdle. We can easily transform a body very effectively, and people start feeling better rapidly. The next area of peptides have to do with bone growth, bone regeneration, arthritis treatment, cartilage treatment. So for bone regrowth, we do have IGF-LR3, and it's been shown in osteoporosis, postmenopausal women, to really improve the bone density. So women who've had fractures or women who just on their overall bone density scan have had low bone density, that's a really wonderful peptide to use. It does have other abilities, again, of the growth hormone that also have to do with mild weight loss as well as muscle building capacity, but it has excellent effects on bone growth. For osteoarthritis, we have peptides like AOD 9604. That one has been shown in osteoarthritis to work amazingly. So we are now producing new cartilage cells and new bone cells. And so what that does AOD 9604 has been combined with, for example, hyaluronic acid. And so you have this peptide and you can inject it into an osteoarthritic knee and have a protocol where you get an injection once a week for a month and then once a month for 5 months. And it's been shown to work better than plasma or bone stem cells for cartilage and bone regeneration. So we have ways of helping with osteoarthritis. AOD 9604 can also be used subcutaneously when people have multiple sites of osteoarthritis. We do have other peptides that are more related to muscle healing, tendon healing. So BPC 157 is more involved in tendon and muscle healing, has amazing effect. It also works on the gut for Crohn's disease, leaky gut, those kinds of issues. But when BPC 157 is combined with thymosin beta 4, if there's muscle injury, if there is wounds, if there is tendon repair issues, the recovery speed can be accelerated substantially, and it works really, really well. For people who have muscle loss, so those would be, for example, the elderly who have severe cachexia, meaning that they're very skinny and they don't have much muscle mass. There are peptides like follistatin, and they target specifically the muscle cells so that with an injection you can build muscle back up and make people stronger. So that's that area of bones, muscle, regeneration. There's a lot more that can be done, but that's a good overview. The next area is immune modulation. There is a tremendous amount of wonderful peptides that we can use. So we have things like thymosin alpha 1. Thymosin alpha 1 again stimulates T cell formation, thymus gland. It's been used in cancer treatment because cancer patients, their immune system is downregulated, and so they're unable to see the cancer cells and eliminate them. So other viral illnesses have been treated with this, Lyme disease and hepatitis. When we're using it for the treatment of things like Lyme or other microbial diseases, we can combine it with LL37, which has profound anti-inflammatory effects, and it actually is an antimicrobial peptide. So it can kill bacteria, funguses, and viruses. And so the combination, again, is very, very important. For mold toxicity, we have things like VIP. That's because a lot of people with mold toxicity are also cognitively impaired from the inflammation. That's very useful. Melanotan 2 is a peptide that also helps with mold toxicity, the cognitive impairment of it. It is usually called the tanning peptide because it actually stimulates melanocytes, which are the cells that make your skin color. So they can give you a tan via a peptide, and it will darken your skin. And it's been shown to have significant properties to protect you from melanoma as well as UV light exposure. Thymosin beta 4, which has also been used in wound healing, is currently under investigation for HIV, for influenza. So it's broader use for some of the severe infectious agents are definitely there. So if we have a good repertoire, plus all the other things that we do, like nanoparticulate silver, etc., that we can add to that regimen. So the peptides are an important cornerstone of combination therapy. For cancer, we have a number of peptides. Thymosin alpha 1 can be used. It's been used in hepatocellular carcinoma, many other chronic cancers. We have a brand new peptide for cancer that is very exciting. It is called metenkephalin, and it's an opioid antagonist receptor. It's been shown that in stage 4 pancreatic cancer to extend lifespan by 3 times. It's been found to have substantial immune boosting effects. It is effective against triple-negative breast cancer, which is the worst kind and most aggressive kind of breast cancer that you can have, colon cancer, squamous cell. So that's a very promising anti-cancer peptide. We do have other peptide for cancer as well, and there's more coming out. So the area of cancer treatment is definitely evolving rapidly and has some really promising areas there. Other peptides like the epithalone, for example, have also been shown to have anti-cancer property by inhibiting angiogenesis. Thymidine has been shown in solid tumors to reduce tumor growth by 78%. So again, when we're looking at the individual patient, we can combine different peptides according to what really is needed and the severity of disease. The next category of peptides, which is really exciting and it's an emerging cutting-edge field, are the skin peptides and skin anti-aging peptides. So I talked to you a little bit about GH copper. GH copper is specifically targeting collagen. So collagen is obviously what is making the skin elastic, and as we get older, the collagen degrades, and so the skin becomes more wrinkled. So GH copper can be used also in a cream and applied to the face and has significant rejuvenating properties and anti-wrinkle properties. We have 3 brand new skin peptides that are really amazing. So they're agrenylene, SNAP8, and Lufazil. So agrenylene is a peptide that actually acts like Botox. So Botox, like peptides, will literally, through topical application, they have profound anti-wrinkle effects with reduction in wrinkles, depending on the individual, anywhere from 28% to up to 50%. When it's combined with something like Lufazil and GH copper, which we have a combination cream that is being compounded by our amazing pharmacy, TaylorMade, they are then accessing different areas and different mechanisms to help with these wrinkles. So Lufazil is an acetylcholine receptor inhibitor. It works on inhibiting the neurons in the skin that are associated with wrinkle formation. SNAP8 is just coming out and it has been shown to substantially reduce the depth of wrinkles. So in the cosmetic area, we can offer a lot now. Again, GH copper is part of that, so when people have hair loss, we can regrow hair, we can make skin look younger. So in essence, with these peptides, we can reinvent someone. The peptides themselves, they need to be utilized also in combination with nutritional therapy, with hormonal therapy. We do bioidentical hormones here because basically if you tell the body, go ahead and rejuvenate yourself, but you don't have all of the nutrients and the basic components to do so, or you don't have the basic hormones to do so, then that would be difficult. But when we use our approach of nutritionally optimizing you, hormonally, metabolically optimizing you, and then we use peptides, the effects are quite extraordinary. And this is really the future of medicine. This field is growing rapidly. The research is amazing. The applications are extraordinary. So is it possible that a human being could live 150, 200 years? I think that people, the researchers and the scientists, they are cautious, but there are enough people now who are doing this kind of work, who are absolutely invested and are are positive, including me, that this is an absolute possibility that is becoming real every day. Because the idea is that we have all of these interventions. We have senolytics. Senolytics are compounds that remove aging cells from the body and have been shown to substantially reverse aging in humans as well as animal studies. And when we combine all of these things and we start early, I mean, we can do this in an older person, but if we start it before 50 and each year, you know, we reverse you by a few years and we do this continuously, then, you know, by the time that you are, you know, 60, you're going to be 40. By the time that you're going to be 70, you're going to be, you know, you're going to continue to grow younger. And there's going to be more and more things that come out as solutions. So I do think that the psychological aspect of this, the aging component due to chronic stress is very important, and that having peptides that can help us with controlling anxiety and depression, which is such a big thing that's driving our adrenal fatigue, our nervous system burnout, and inflammation in the body. So there's just all of these areas that we can intervene and enhance the human and really create the future human now. I hope you enjoyed this update. All of these peptides and treatments are available at AM Medical. They are continuously updated, and there's more innovation coming down. I'm part of an international peptide society that is not standing still. There's new stuff coming out every day, and we are excited to bring it here to AM Medical in Yelm, Washington, and we look forward to serving you. Thank you.